Well, it's been a whirlwind day of news conferences and unprecedented announcements. We have team coverage tonight on all of the COVID-19 updates, including those new restrictions at the border. But first, we begin with the about face from Ontario's Chief Medical Officer of Health, who called for a shutdown of restaurants and bars hours after he said it wouldn't be necessary. Now, while businesses say they do understand the need for these drastic measures, many are concerned about how long those closures might drag on and how their staff will be able to make ends meet.
And it's just bad news for everybody.
Dave Auger was supposed to be celebrating the one-year anniversary of his sports bar 817 Queen, but instead he and his staff are closing up.
They're panicking because they rely on their tips, the wages, and and there's nowhere they can find work. Everybody's on shutdown right now. This is lockdown.
Should all bars and restaurants in Ontario now close?
We recommend that they should, except those they could maintain services for takeout and delivery.
That clarification came from the province's chief medical health officer this afternoon, just hours after he'd said it wouldn't be necessary. The reason for the sudden change? Fears about possible community spread in the province after positive cases weren't linked to any travel.
There have been a small number of cases where the public health units are still doing the investigation, but they have not been able to find a clear link to a case. So we're saying, to be conservative, we're saying we cannot rule it out at this point.
City Hall went one step further this afternoon, urging not just bars and restaurants to close, but also concert venues, nightclubs and theaters, warning those who don't heed the strong recommendation as of midnight that they could face consequences.
I did speak about the possibility of orders under the Health Protection and Promotion Act, and under that act, if one is found guilty of an offence under that act, a fine may be applied, and it may be as high as $25,000 per day.
I don't know how it will affect us. I mean, I'm scared right now. It would help if I had an idea of what my timing is.
At the Midfield Wine Bar, Giuseppe Anile is prepping for a shutdown he says couldn't have come at a worse time. The restaurant was undergoing renovations aimed at expansion.
We have some new equipment that arrived today. Had we known that we'd be closed for 2 weeks and that we wouldn't need it and that it would make being open or taking care of ourselves and our employees harder, I don't know if we would have done it.
Back at 817, Auger is hoping there will be some relief for his staff.
EI is a very small amount to pay bills, and you know the cost of living in the city.
We need to protect the people working the line or doing shift work who don't have that luxury. And the last thing we want right now is for people to worry about job security.
Premier Ford announced he is introducing new legislation to protect workers who have to self-isolate because of the coronavirus. But it's unclear if there will be funding for businesses forced to shut down.
How long do you expect that you could deal with a closure? And at what point do you start to say, okay, we've got to really evaluate here?
Ideally, 4 weeks. 8 weeks, it's getting quite costly, and getting it 12 weeks, that's a long time.
Now, another closure to tell you about after that recommendation to limit gatherings of 50 people or more. Cineplex says late tonight it will temporarily close all of its 165 theaters countrywide due to the rapid spread of COVID-19. That closure begins tonight and will last until April 2nd. All locations of the Rec Room and Palladium will also be shut down. The company says it's making the move out of an abundance of caution.